Hey there, welcome back to TanuWellness, your Physio and Pilates Hub, and I'm Dr. Tanushree, your Physio and Pilates expert. In today's video, we're going to dive into a condition which affects many of us, and that condition is lumbar spondylosis. If you've ever experienced persistent lower back pain or stiffness, then this video is for you. We'll explore what exactly is lumbar spondylosis, how is it different from similar conditions, and what can be done to manage and prevent it. And like always, there is a bonus section towards the end where I'll be demonstrating 5 simple exercises to manage this condition. So stay tuned. And here's what we're going to cover today. First, I'll explain what exactly is lumbar spondylosis and how it affects our lower back. I'll also discuss how is it different from similar conditions such as lumbar spondylitis and lumbar spondylolisthesis. We'll go over early signs and symptoms of lumbar spondylosis and discuss how age and diet play an important role in its development. Later, like I mentioned earlier, in a bonus section, there'll be 5 simple exercises, and also we'll be seeing the importance of lumbar supports. Additionally, we'll review the different types of imaging techniques. So stay tuned till the end. If you're new to my channel, don't forget to hit the subscribe button and click the notification bell so you don't miss out on our weekly physiotherapy tips and exercises. If you find this video helpful, please give it a thumbs up and do share with somebody who might benefit from this information. So what exactly is lumbar spondylosis? This condition refers to degeneration of the lumbar spine, which is the lower part of our back. Now, as you see in this spinal structure, the lower part, the green part, is our lumbar spine. This comprises of 5 vertebrae, 1, 2, 3, 4, 5, the green part, and in between the vertebrae, there are discs. Now, these discs in between the vertebrae have cushioning ability, but over the period of time, it loses its ability to cushion, leading to bony spurs and other degenerative changes that causes a lot of stiffness, back pain, and limited mobility. Also, lumbar spondylosis is often associated with osteoarthritis, where the cartilage that cushions the joint breaks down, causing a lot of friction. This leads to inflammation, and in some cases there is nerve compression. So understanding what exactly is the anatomy of our spine is very important if you want to understand what exactly is lumbar spondylosis and how to prevent and manage it. Let's clarify the differences between lumbar spondylosis, lumbar spondylitis, and lumbar spondylolisthesis. These terms are often confused, but they refer to different conditions. Lumbar spondylosis is a general term used for degenerative changes in our lumbar spine, as we discussed earlier. It is primarily a wear and tear condition that affects the disc in our lower back. Whereas in lumbar spondylitis, itis means inflammation. This is inflammation which is caused in the vertebra, and that is usually seen in autoimmune conditions such as ankylosing spondylitis. And the third one, which is a lumbar spondylolisthesis, in which there is moving of one vertebra over the other. So if you see in the vertebra, if this is L1, L2, L1 will slightly move over the L2 vertebra, causing compression of the nerve. So understanding the difference between these 3 conditions is very important for not only treating but also preventing the condition. If you're finding this video helpful, please take a moment to like, subscribe, and share with someone who might benefit. Your support means a lot to us, and it helps to create valuable content like this. And remember, there's a bonus section on the best 5 exercises for lumbar spondylosis coming up at the end of this video, so be sure to stick around. Recognizing the early signs and symptoms of lumbar spondylosis is key to managing this condition before it becomes severe. The most common sign is lower back pain, which can range from dull aching pain to a sharp stabbing kind of pain, especially during movement. This pain is often associated with periods of inactivity, such as when you wake up in the morning or if you're sitting for prolonged hours. You might also experience stiffness in the lower back, especially when you get up in the morning. Now, when you are having a lot of pain, a lot of stiffness, there are chances that your nerve is also getting compressed. If you are experiencing numbness, tingling sensation down your buttock to your leg. So there's a condition known as sciatica. When this nerve named sciatica gets compressed, you have along with lower back pain, you have pain in your glutes, your lower leg and till your foot area. So additionally, you might notice a reduced range of motion in your lower back pain also, making it difficult for you to bend or even twist. If you're experiencing these symptoms, then make sure that you consult your healthcare expert before you start any treatment and for proper early diagnosis. Do you know lumbar spondylosis is closely related to aging and diet? Yes, you heard it right, diet as well. Now, as we know, it's a degenerative changes. So as we age, the disc between our vertebra is going to lose water content and elasticity, making it less effective at cushioning the spine. This can lead to development of bony spurs and other degenerative changes. But diet also plays a crucial role in maintaining our spinal health. A diet rich in calcium and vitamin D, other nutrients are essential for maintaining our bony health. Also, don't forget to include anti-inflammatory food such as leafy greens, fatty fish and nuts that can be beneficial in managing the symptoms of lumbar spondylosis. Have you ever wondered why lumbar spondylosis is so common in corporate world? There are several reasons, but one of the major reasons is prolonged sitting, especially in front of your laptop or computer. Sitting for prolonged periods with poor posture can put extra strain on the spine, not on your neck muscles, but also on your lower back area, leading to accelerated wear and tear of the lumbar spine. The repetitive nature of desk work combined with lack of movements will increase the symptoms. Over the period of time, these factors contribute to the development of lumbar spondylosis, making it a so common problem in the corporate world. Now, what's the solution? So, the first thing is you're going to do is take regular breaks. Do stand and walk around for a few minutes. Start stretching. Desk exercises can be done just sitting at your desk place. And ergonomic adjustments are the key. You have to adjust your desk, your place where you're working to reduce the symptoms of this condition. Diagnosing lumbar spondylosis typically involves imaging studies that can help visualize the degenerative changes in the spine. X-rays are usually the first step to show any bony spurs, disc space narrowing, and other structural changes in our spine. However, X-rays don't provide detailed information and they will not show you soft tissues. CT scans offer a more detailed view of the bony structures in the spine that can help identify issues such as not only bony spurs but also vertebral misalignment. Now, MRI scans are the most comprehensive as they provide both the bones as well as the soft tissues, including the disc, nerve compression, spinal cord. MRIs are particularly useful for identifying herniated disc, nerve compression, and extent of this spinal degeneration. Managing lumbar spondylosis often involves the using of lumbar supports to help reduce symptoms and maintain a proper posture. Now, the first one is lumbar braces. These are commonly used to provide external and additional support to lower back, reducing strain on the spine during activities. These braces can be particularly helpful during flare-up of the pain. 2. Now, when you're sleeping, there are pillows, ergonomic pillows, the ergonomic wedges, which can be kept not only in between the knees, but also can be kept under your back to give that extra support to the back and to maintain a proper S-shaped curve of your spine. Third is ergonomic chairs. Now, these are very important supports where you will be using this in particular in your office. So, if you're sitting upright, there's a particular ergonomic chair which has a lumbar support. So, when you sit, it aligns the natural curve of your spine, giving that extra cushioning effect to improve your posture while sitting for prolonged hours. It is important to use these supports under the guidance of a healthcare expert. The first step is to diagnose this condition and then go for these supports. Now we'll be doing knee to chest. In this, you're going to be in supine position, face up position, hands by the side, fold your knees, gently start pulling your knee closer to your body gently, and then start hugging your knee closer to your body. Once you're comfortable, start lifting your head slowly. Hold for 5 seconds. 1, 2, 3, 4, 5, and gently relax. Repeat it on the other side. Lift your leg up, hug your knee, start lifting your head. Hold for 5 seconds. 1, 2, 3, 4, 5, and relax. This is in the initial stage when you have a lot of lower back pain. Then once you're comfortable, try lifting both the legs together. That's the modification. In this, you're going to lift one leg closer to your body, lift the other leg, and start hugging your knees. Hold it tight, lift your head, hold for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Head down, start dropping your leg one by one and relax. We'll be doing figure of 4. In this particular exercise, you will be lying supine position, face up position. Fold your knees, lift your one leg closer to the body, and then start placing your foot on the other knee. Start pulling your other leg the way I'm showing you. Hold for 5 seconds until you feel a nice stretch in the gluteal area. 1, 2, 3, 4, 5, and relax. Now another thing is, if you have a lot of back pain, then you can stick to this position. If you feel you're getting a little better, then in the same position, it should look like a 4, figure of 4. Keep your leg down, relax. I'll show you the modification. Lift your leg, place your foot again on the knee, hold your leg and start lifting your head up. Hold for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and gently relax. This is an excellent exercise for reducing your back pain. Not only it works on the glutes, but it's extremely important when you have a lot of stiffness in the back. Lumbar rotation stretch, one of the excellent exercise for reducing stiffness of the lower back. In this, you're going to be in supine position, face up position. Place your feet together, hands on the sides. Relax your upper body and start rolling your knees on one side. Hold for 3 seconds. 1, 2, 3, and return to the starting position. Go on the other side. Hold for 3 seconds. 1, 2, 3, and relax. Remember 2 important things. Try to keep your feet as close as possible for a greater stretch. And second thing is, don't hold your breath. In fact, when you're rolling side to side, try to tuck your tummy in and relax. Lumbar extension stretch exercise, another great stretch for reducing stiffness of your lower back. Now in this, you're going to be prone position, face down position. Keep your hands closer to the body, keep your head down. Make sure your elbows are on your bed and start stretching your neck. Slowly go up until you feel a nice stretch in the back area. Hold for 5 seconds. 1, 2, 3, 4, 5, and relax. Once you feel a little better, you can go off your elbows. Now slowly start stretching. Hold for 5 seconds. 1, 2, 3, 4, 5, and gently relax. Bird dog exercise, excellent for reducing stiffness and lower back pain in lumbar spondylosis. In this, you're going to be on your fours. Lift your hand up and then lift your opposite leg up. Hold for a second and relax. Then go for the other side, hold for a second and relax. Once you develop balance, then we can hold for more seconds. In this, you're going to lift your hand up, lift your leg up, hold for 5 seconds. 1, 2, 3, 4, 5, and relax. Lift your leg up, lift your hand up, hold for 5 seconds. 1, 2, 3, 4, 5, and relax. And that's a wrap on our today's video. We covered everything from what exactly is lumbar spondylosis and how is it different from similar conditions. We saw the causes, the best exercises to manage it. Not only this, we saw the list of lumbar supports and why is it so common in corporate world. So if you found this video helpful, make sure to subscribe to my channel TanuWellness Physio and Pilates Hub, and do share with somebody who is having this condition. Don't forget to check out our other videos for more in-depth guidance on exercises and maintaining your overall well-being. Thanks for watching and see you next time.